Welcome to The Miracle Moment. My name is JJ, and I am excited to bring back Dr. Kenneth Orbeck to the show. Welcome, Dr. Orbeck.
Thank you, JJ. Thank you for another great introduction. We're having fun here with hormones, aren't we?
We certainly are. And to that point, we were just discussing the importance of hormones and how they play a vital role
Absolutely.
in our overall health holistically. And you were discussing about this importance between, cell-to-cell communication and the role testosterone plays and the benefits it plays on our overall health. And I'm curious, are there any more thoughts that you have around testosterone before we head off into a different hormone?
Well, I often call testosterone replacement a forgotten hormone in women because it's not often given to women. It's more thought of as a male hormone, but it's not. It's a hormone that's very common in both men and women. If you look at the relationship between hormones, testosterone is 12 times more more content in men than it is in women, and 1/12 in women than it is in men, where estrogen's reversed. So estrogen is in men as well and important in men, but it's only 1/12 of what it is in a woman. So the two hormones are reversed. 12 times more testosterone in men, 12 times more estrogen in women. That doesn't mean you don't have to still watch and replace and look at the other hormones for total symphonic balance. We talked about that, right?
Absolutely, our orchestra.
Yes, we were talking about testosterone replacement therapy. We went in and dove real deep into that. I just want to finish up with a couple other thoughts that I have on testosterone replacement therapy because we're all concerned about our metabolism. If there's anything I hear in my office that's like disheartening to people, is like, why do I work out 4 times a week? Why, when I'm eating clean? Why can't I get my body back in shape? Why can't I burn this fat? Why am I having all this problem? And it's related to a lot of different factors. One, of course, could even be cortisol, but testosterone is very, very important, okay? So testosterone metabolism, if we look at the male population, there's 2 things I look at in the men. I look at their total testosterone and their sex hormone binding globulin. SHBG actually binds testosterone, makes it unavailable, all right? And there's an independent risk factor where you look at testosterone and SHBG in men, okay? So in men with a high SHBG and low testosterone have a higher indication of metabolic syndrome, okay? Metabolic syndrome actually is a problem with insulin utilization and glucose transport, okay? Which is really important, all right? So metabolism and testosterone go hand in hand. Not replacing it is going to put someone at a disfavor as far as being able to maintain muscle mass, having exercise therapy actually make a difference. That's important, okay? Testosterone replacement therapy will act as a signal, okay? It'll actually decrease central adiposity, which is right around your midsection, all right? Visceral fat is important. Visceral fat is associated with age-related diseases, right? Diabetes, heart disease, heart attack, stroke, all that, okay? You can have a favorable change in your body composition when you balance testosterone properly.
Okay, so identifying your levels of the visceral fat and all of the things that are important that testosterone will help you fix, utilizing that body mass indicator, that will help you understand what are the percentages, what do you need to actually change, and how testosterone will affect them positively.
It will, and we do that on a regular basis. We look at body composition, we measure fat, we measure muscle, and that's really important to set out a game plan and then look at your hormone replacement therapy and the effects it has on the body and the metabolism. So we've now looked at testosterone replacement therapy and metabolism. We looked at it in other aspects. Let's talk about now how it affects you as far as your psychological component of living, because that is a very important component. Being psychologically fit, allowing yourself to have the joy and the happiness of living psychologically, right? So if you look at testosterone replacement therapy, higher levels of bioavailable testosterone are associated with better cognitive function. We have seen that in studies, okay? We all want good cognitive function, okay? Testosterone has almost like an analgesic and cognitive enhancing effect on the body. That's very important. It may actually be in part active on 5 alpha reductase metabolites in the hippocampus. The hippocampus of the body is very important as far as your psychological mood. All right. So we look at all these things, and we can see that that testosterone replacement therapy has a role on how you feel as well. How are you vital?
And when somebody doesn't have the proper testosterone, you had asked me one time about the cloudiness, right? Are you feeling cloudy in your thought? Do you feel foggy? You're not really sure what to do. And what you're saying is this could be affected by low testosterone on women and men.
Correct. Yeah. The 3 hormones that I really look at when I look at mood and psychological aspects of metabolic health would be testosterone, estradiol, and IGF-1, which is a part of growth hormone. Those are the 3 that really have a good relationship with the hormonal aspects of psychological health, mood, and well-being.
Dr. Orbeck, with the way we all live today, our environment is clouded with toxins and pathogens. Do hormones affect at all our immune system, having a healthy way to combat what we experience day to day or not?
That's an excellent question. I love that question. Immunology is one of my loves in my practice, and I have a lot of individuals that may come in with like autoimmune disease or immune dysfunction. The immune system must be maintained as we age. Immunosenescence, which is a decline in your immune system, is associated with aging, and that's not good. You really got to maintain immune health. And we all know that over the past years of how we lived through the COVID years and what's going on in the environment today, it's almost scary to open up your door and walk out in the environment with all the pathogens that we may be exposed to. So immunology is important. And we were talking about testosterone, and testosterone does affect basically the immune system. It has a direct effect on CD4 T lymphocytes, which are a major part of the immune system, and it increases interleukin-10 production. Interleukin-10 is an anti-inflammatory. Testosterone is capable of inhibiting the synthesis of other inflammatory cytokines. Inflammatory cytokines like TNF-alpha, interleukin-2, interleukin or interferon gamma. These are all terms that I'm using here to be more technical, but these are important aspects of your immune system that we want to maintain as we age.
Well, what happens when we're inflamed?
When we're inflamed, we get a Th1 increase in our immune system response. So Th2, Th1 immune balance is really important as we age. Th1 immunity goes up, that's with inflammation, and then you tend to get more of a, like an inflammatory cytokine storm, which can affect the body. It affects how you feel, it affects the joints, and can also end up with autoimmune issues.
Thank you for sharing that. The inflammation, I know, is such a hot topic as well. So it's interesting to learn how the testosterone replacement can help someone with that particular insight.
Absolutely.
We talked about testosterone at length for men. Can you talk to us a bit more about how it affects women?
Oh, yes. And it's the forgotten hormone in women, right? So testosterone is very important in women. Testosterone is produced from the ovaries and is produced from the adrenals. About 50% of the testosterone is produced from the ovaries and 50% is produced from the adrenal glands. When a woman goes through menopause, when they lose their ovarian production of hormones, they're losing a significant portion of their testosterone production. All right? And so it's going to really affect how they feel. They're going to have a reduction in libido. And so testosterone is going to increase libido. They're going to notice, again, we talked about this at length, they're going to have an increase in their fat and a reduction in muscle mass. So in women, yeah, it's still very important to replace this, to maintain their body composition. And guess what? It helps protect the bone. Is osteoporosis or osteopenia ever a concern in aging women?
Absolutely. It's a topic that I hear a lot about, especially now with aging parents.
And you know what? That should be a disease of the past. Osteopenia and osteoporosis is preventable. We just have to have a higher index of suspicion. We need to get more DEXA and bone density screenings going on, look at the bone, and if the bone starts to decline, there are ways to prevent that. With simple hormone replacement therapy, the proper amount of vitamin D3, and then different entities that we can even add on top of that to keep the bone healthy. All right, so that's really important. Symptoms of low testosterone, we can talk about in a woman. They're going to notice that their muscle mass is reducing, their muscle tone, which is why they're fighting at the gym so hard. They're going to gain some weight. Fatigue, a big component of testosterone reduction is fatigue. They'll have lower self-esteem. We talked about that with the psychological aspect, remember?
Mm-hmm.
They'll have a reduction in sex drive. I had a patient this week in tears in my office, sobbing, because for 15 years, she said, Dr. Orbeck, I neglected my husband, and I cannot believe he's still married to me. For 15 years, I didn't care, and I refused intimacy with him. She was sobbing. She goes, what has happened recently in the last 3 months of having my hormones replaced? You've restored our marriage. My husband is happy, and I feel good about who I am.
What a testament.
It's imperative that we have to look at the quality of living. Quality of living is the key. You know, it's not wake up, go to work, eat dinner, go to sleep. It's not what life's about. It's about being productive, proactive, maintaining intimacy and love, right? Correct? So yeah, that's a big aspect. And in women, what do they complain about as well? Dry, thin skin, right? Losing hair, hair thinning, nails cracking, brittle nails, anxiety, right? So that's all important.
These are all things we talked about in the beginning when we first started the Miracle Moment, which was restoring beauty from the inside out.
Correct.
And also giving individuals hope.
Absolutely. So, I mean, if I had to summarize on testosterone replacement therapy and the benefits, it would be increasing your desire of intimacy and sexual interest, increasing the sense of well-being and confidence within a person, increasing muscle mass and tone, all right, decreasing excessive body fat, maintaining bone strength, elevating neurotransmitters, helping you psychologically have a better mood, and helping you maintain your memory. Those would be probably the aspects that I would look as testosterone benefits with replacement therapy.
And it sounds like, to me, it's in every aspect of your life. You could see an improvement.
Absolutely.
Thank you so much, Dr. Orbeck, for sharing additional thoughts on testosterone. We appreciate you all joining us for the Miracle Moment, and we look forward to seeing you again next time while we dig deeper into hormones.